We're going to be talking in this portion of the program with Paul Seegert, managing partner at PCS Advisers, financial advisor, to talk a bit about Amazon launching an online pharmacy. Really? That strikes me as odd somehow, Paul Seegert. It's like I would expect to go to my neighborhood Chevy dealership to pick up a loaf of bread.
I can see what you're saying, but you've got to keep in mind that they're famous for saying your margin is my opportunity, and prescription drugs are the fastest rising cost in healthcare. So they do represent a big opportunity that they can get in on.
Now, I guess what Amazon will be pushing is distribution. Are they going to be telling us that, and I assume that they will therefore hire good pharmacists and all the rest of that, are they, since cost is the big issue regarding drugs in this country, legal drugs, then are they going to tell everybody you can get your prescription cheaper at Amazon?
Well, they might say that, but I did run I had it sent to me. I didn't run it myself, but the 10 most commonly prescribed generic drugs, if you were to buy a typical dose from Amazon as a Prime member, you would spend $101 today, and you can get those same prescriptions from GoodRx at $34, Kroger at $24. So I think they're more so relying on a dedicated customer base of 80 to 100 million Prime members who will just add it to the convenience of all the other things showing up in their Amazon boxes.
Well, that's a mighty big difference, though. I mean, to save a couple of bucks, I might say, forget the couple of bucks. I'll just go ahead with the convenience. But this is a lot more than a couple of bucks. I can't imagine there's a customer base that would spend that much.
Yeah, I think what it really points to is that many of us in the industry were thinking that they might come in with disruptive payment models, economies of scale, and provide some real alternatives to the current model for the underinsured and employers, and they really haven't. They've said, let's join the status quo, get involved in this drug channel because of all the dollars that are at play, and most of the money will be made by servicing those with insurance. So they're going to accept insurance, and those consumers with insurance will consume in terms of their copay, and so they'll be a little bit insulated from that cost difference.
All right. Now, as we look at anything involving big digital, quite frankly, I approach it with a huge skepticism, be it Twitter, be it Facebook, be it Google or Amazon, anybody. Right off the bat, I must confess my first predisposition is how are they going to use their immense power to screw me over? Now that may be short-sighted on my part, and I would like to think that I will examine in a careful and fair manner, but I have an automatic predisposition in that direction. When in doubt, don't, and I don't think I'm alone.
I don't think you are either. I was having a conversation with a friend earlier today, a work associate, and he's a millennial. And his first question was, what will they do with my data now that they know all the drugs that I take? What else will they attempt to sell me the next time I log in? So I think that's a legitimate question.
Yeah. Overall, where does Amazon stand? I know they've launched Amazon Pharmacy, and if I launched Bohannon Pharmacy by a couple of years from now, if I'm lucky, I might have a couple of hundred customers. With Amazon, they can shrug their shoulders, they can lift an eyebrow, and they've automatically got 20 million customers. So, am I to assume that this thing is going to be up and running full bore in the next couple of weeks?
I think it's here to stay, and it will make an impact. It won't affect, at least in this rendition or this version of it, I don't expect that it'll make a huge impact to the whole supply chain. They haven't made an effort to do that, really, but it will affect the retailers involved, Walgreens, CVS, Rite Aid. They took a $10 billion hit in market share. They did in 2018 when Amazon acquired PillPack. The same thing happened. They bought PillPack, and the market reacted strongly, and they went down 10%. Those companies' market share declined 10%, which is about what we're seeing now. But within a few months, they were back. This, though, I think will have more of a long-lasting effect, and the retailers are certainly the most vulnerable to what this move that Amazon's making.
And I gather that this is another example of where being an Amazon Prime member is going to be a good deal.
Yeah, the members, if they can either use their insurance or they can get a discount member price. Surprisingly, they've simply white labeled a discount card that already exists. There's been some discussion of this replacing GoodRx. It clearly doesn't seem to when you compare the GoodRx pricing on those 10 most common generics at $34 versus Amazon Prime price of $101. So I think the bigger play is for those with insurance.
Okay.
But they do have a discount card. Really what they've done is put together a discount card with a mail order pharmacy. And the difference between Amazon is that they have one discount card that they're white labeling, Express Scripts, and then GoodRx goes through multiple, 4 or more.
All right, we'll pause early here, and we'll come back with some more. Paul Seegert, our guest, managing partner at PCS Advisers, online at their name, PCSadvisers.com. Back in a moment. Welcome back to the Jim Bohannon Show, 1-866-50-JIMBO, 1-866-505-4626. Paul Seegert, managing partner with PCSadvisers.com. We're talking about Amazon launching its online pharmacy and prescription delivery service. Now, as I understand it, PillPack, which Amazon picked up a couple of years ago, will continue to serve customers since PillPack is aimed mainly at those who take multiple prescriptions for chronic conditions. So the two will, in effect, work side by side and or compete with one another?
Yeah, they'll work side by side and continue with that mission. I think they'll both contribute to that Amazon flywheel that just adds momentum every time they add a product or a service. They bring more customers, which results in more products and more sellers and lower prices, hopefully. And so, yeah, they'll both continue to operate. Or PillPack will continue, and the pharmacy, of course, will add on. The mail order pharmacy, though, one difference there is that folks will be able to go to Amazon.com where they go for all of their other goods and services. And there's going to be that added convenience. And I think that will benefit them quite a bit.
Overall, from the consumer standpoint, is this then just another way to get your drugs, and it's, in other words, an additional option and therefore good for consumers, or is there a downside here?
Well, I think it's a somewhat neutral outcome, surprisingly. I think we'll see that some of the small Main Street pharmacies may go by the wayside because it's going to put more pressure on the retail end of things. The large national pharmacies have some services, for instance, flu shots or even COVID vaccines that they could administer on site that Amazon won't be able to compete with. They're going to have more durability. So it may affect the Main Street smaller players. But from a cost standpoint, they would have had to have approached it in a very different manner to use their economies of scale for lower pricing for the overall market. That hasn't happened the way they're approaching it.
All right. So do the big chains, the CVSs in the world, have anything to fear? And do the little mom and pop pharmacies, if there are still any, do they have anything to fear?
Yeah, I think they both do. The mom and pops, this could be the death blow to some of them that are just hanging on. And there has been pressure on the CVSs, the Walgreens, the Rite Aids. Some of their revenue has been hurt in general from mail order because folks aren't going to the pharmacy as much, so they're not picking up some of those other items, grocery-type items that they would have gotten. And that's where Amazon can really win because they're going to be able to provide the dog food and everything else while you add your prescriptions. And if you're an insurance payer or buyer and your copay is going to be the same regardless, why not just add it to your Amazon order? So there will definitely be an impact to both.
So should Congress be interested, the FDA, the SEC, anybody should be interested, or should we just sit back and say, okay, there's another option?
I think it's an okay, there's another option. If we had seen a disruptive payment model where they could have used their economies of scale, would have been Amazon coming into the market and saying, We're not going to take insurance because of all the contractual rules that would constrain them in that arrangement. And we are going to do a cash plus fee-based model. And that would have been a huge shift in the market.
No, what exactly is a cash plus fee-based model? That's not intuitively obvious to this layman.
Yeah, the pharmacy benefit managers, the middlemen behind all of these retailers that supply drugs to the system, add a lot of cost. There's things called rebates, dollars that are attached to these drugs that become an extra source of revenue for the health insurers, and really everybody in the supply chain. And it represents 20 to 30% of the cost of most prescriptions. 60% could be as high as 60% in the case of insulin. And so it really drives up costs without a lot of value. And the players throughout are really benefiting from that in the status quo model. And if you take insurance as an example, as a pharmacy, if you take insurance, you're not allowed to make drugs available at a fair cash price. The insurers that you contract with will tell you what your cash price can be, and they set it at a number that is of their choosing that makes the insurance price appear to be a good discount when in fact it is not.
The term comes to mind, and again, I'm no lawyer and no businessman, but the term price fixing just jumped out at me just then.
I could see where you could draw that conclusion, for sure.
In other words, that's a legitimate concern.
Oh, absolutely.
I mean,
you look at...
Okay, go ahead.
Yeah. One example, generic for singular, montelukast, if you are a pharmacy that takes insurance, and you have a person, just an average American, walk through the front door, and they would like to pay a cash price, the insurers require that pharmacy to charge $400. And
that's ridiculous. That is the most ridiculous thing I've ever heard. Now, if that is not an illegal restraint of trade, then I don't know what is.
Absolutely. And the discounted insurance price is $25 for that 90-day supply, yet a fair cash price, if you were to get it directly from the manufacturer with a small markup or a reasonable markup, would be $34.50 for an entire year. So $400, the insurance company tells the pharmacy, this is what you can sell it to a consumer as a cash price, when in reality it would be $34.50 or about a penny a day.
Certainly something ought to be done about that. Now, looking ahead, there is, as we speak, a pretty fair likelihood that there will be a Democratic President, Joe Biden, inaugurated January 20th, and that he will face the divided government with a Democratic House slightly and a Republican Senate slightly, and a fairly conservative Supreme Court. With all of those things in the path of what some Democrats might want to do, how do you see that affecting what we do as regards obtaining drugs? I don't really see, for example, Medicare for all necessarily flowing through here, but I could easily see government action that might tend to impact things like where you get your pharmaceuticals.
Yeah, I think what we can expect there would be some interest in getting a public option passed. That is Biden Care. If you go to the Biden website and you read their health plan, it's Biden Care is really getting the public option in, and that was something that they really wanted to have as part of the original Affordable Care Act, but had to give up in the end to get it passed. And it would add more people to a government option. It wouldn't replace private insurance, but it would essentially expand Medicaid in the system and provide it to more Americans. The challenge with that is that those payers, Medicare and Medicaid, as a payer to the healthcare system, they go in and pay hospitals and all the players in the system, providers of any kind, generally at a rate that's not profitable. Most hospitals, as an example, need to collect 118 to 120% of Medicare payment just to break even. So then what we see is that cost gets shifted to the commercial payers, to the employers that are providing healthcare, and to the individual buyers of healthcare in the marketplace. So it's really just a cost shift that occurs. It doesn't help control costs overall for healthcare and take this huge sector of our economy that's clearly out of control and add any control. So I think, unfortunately, that's the direction it would go if politics allow it to go there, and it will accelerate the pace that we see costs going up.
You got any good news for us? Anything optimistic we can look forward to?
Great point. Well, I think the good news is that a lot of that won't happen. Most likely, it appears, as you pointed out, we'll have a divided government, and that public option would be a very tough thing to get done in that scenario. So likely we're in a status quo situation.
For the average person out there, let's say, they have normal, I know that we cover a wide spectrum of audience, and certainly there's a wide spectrum of people in the country, but for the average person, middle class, what have you, and no particular major medical problems, does this Amazon pharmacy sound like something worth exploring?
Yeah, I think they'll take up a lot of market share. I don't take, I'm generally healthy, so is my family, thank goodness. We don't have prescriptions, but if we did, would we consider adding it to our Amazon order? Absolutely. Just for the sake of convenience, if we were purchasing it through our insurance plan and our costs were going to be our copay regardless, why not?
If Amazon can make,
that's the approach many will take.
If Amazon can make money doing this, why shouldn't some other giant decide to get into this line of work as well?
Yeah, they very well could. This is their third move in. I think this will be the most successful. But will that change? This is one of the unique things about healthcare. Is it really adding competition, or is it just another place to go pick it up at the same price? And that, unfortunately, is the reality, that it's not adding a lot of competition or new competition because the pricing is controlled behind the scenes in the supply chain between the insurers and the pharmacy benefit managers. They have such solid contracting on the distribution, the retail end of distribution, that it's really not adding competition, although it appears that it should.
So the whole notion that the problem with drug prices can be approached by additional competition, is that a false hope?
On the retail side, I would say it is. Yeah, unless you had a retailer come out of great size that said, we will not take insurance and we will offer drugs at a fair cash price. But that would be, this would have been maybe one possibility, an outside chance, of course, but one possibility of a big player in Amazon that could have done it, and they certainly haven't. They're joining the channel and perpetuating the status quo, really.
All right. Well, there you go. A lowdown on something that I had not really been aware of, but I certainly am now, as are all of you out there. Again, Paul Seegert, our guest, managing partner of PCS Advisers.com. And Amazon has launched their online pharmacy, allowing U.S. customers to order prescription medications without leaving their homes. And this will be in addition to the Amazon purchase a couple of years ago of mail-order pharmacy startup PillPack, which will continue to serve customers after Amazon Pharmacy launches, because it's designed to serve those who take multiple prescriptions for chronic conditions. Again, Paul Seegert, our guest from PCSadvisers.com. We've got more to come on the Jim Bohannon Show, so stay with us, and we'll be back in just a moment.